There's a diet that's been proposed, and for good reason, to completely eradicate heart disease.
Can an ultra low fat, no animal product diet be healthy and reverse heart disease? Hi, I'm Dr. Eric Westman. Welcome back to my channel where I review and debunk nutritional misinformation online. In this video, we're going to see an interview of Dr. Caldwell Esselstyn, who is, I would say, a pioneer in the use of ultra low fat, no animal product, so plant-based kinds of diets in a clinical setting throughout his career. And he's being interviewed by Nick Verhoeven. I actually met Nicholas at the Citizen Science Foundation meeting. That was a fundraiser for the Citizen Science Foundation, and I like his style. He's a scientist trying to make sense of research in layman's terms. So be sure to wait till the end, though, till you hear my final thoughts.
Claim that if you eat this diet, it eliminates heart disease even if you have heart disease, giving you 100% protection from any cardiovascular event like a heart attack, stroke, or anything related. The idea has been popularized by a physician and scientist, Dr. Caldwell Esselstyn.
So yeah, that's a big claim to be able to fix everything. But this is very similar, the approach that Dr. Esselstyn uses, to something that Duke had here in my hometown and my university for years. It was called the rice diet. Do you remember that one? So the rice diet was ultra low fat. You had rice, fruit, and fish. And by the time I came to Durham in the 1990s, it was still in existence. It was led by different doctors. It wasn't Dr. Kempner anymore who had started it. It was also called the Kempner diet. Somebody misunderstood what he said because of his thick accent and came back not eating rice. And the rice diet was born because it fixed the high blood pressure that doctors were unable to fix at the time. So just giving rice to somebody without fat or without many calories and no sodium can actually cut down the blood pressure in extreme ways. At a time where there were no medications, the rice diet was actually a treatment for high blood pressure. So, clearly you change the diet, amazing things can happen. You don't always have to have a drug, and you don't always have to have a low-carb keto kind of diet that we're most known for. It's just another tool. But so the rice diet is no longer in existence at Duke or in Durham. If you go to the website, they'll say call a number and nobody answers. And no, there is no rice diet physically anymore. You may be able to buy diet books, and I met people who had life-changing experiences with the rice diet, or even with ultra low-fat diets like Dr. Esselstyn is going to be talking about. So always consider the source, and this type of diet is, I would categorize into an ultra low fat and even no junk food type of diet, which is a commonality of all of the diets that are healthy in my mind. Or at least you would minimize junk foods today. So let's get to the interview.
The study that's most popular is this one, and by the title you can see why. In this study, researchers, including Dr. Esselstyn, who we'll hear from later, had 198 highly motivated people that started on an extreme diet. The diet was simply characterized as a whole food, plant-based, and importantly, oil-free diet. All oils are prohibited, in addition to any animal products, as well as nuts, avocados, excess salt, caffeine, kill me now, and if you're wondering what these people were allowed to eat, whole grains, legumes, lentils, vegetables, and fruits.
Yeah, so if there are methods that work and you have to have a certain food choice, this is the kind of approach that turns off a lot of people. In fact, if you look at the natural history of programs like the rice diet, there are not enough people, or I guess the management didn't work. I don't know. It no longer is a residential program where people can go and do the rice diet anymore, perhaps because the food choice is, similar kinds of things I've heard that it's very difficult to do the rice diet, and I hear people say it's very difficult to do a keto diet. So it's interesting that we're both kind of fighting the natural urge to go back to ultra-processed junk foods that, we're inculcated and indoctrinated in eating that sort of food, so we think that's what normal is. No, but so if you are interested in this set of foods, and the study that he's talking about is actually a case series, not a randomized trial, and I think the major difference between the science behind the ultra low fat diets is they haven't really done as many randomized trials, those proponents, as the low carb researchers have done. And there are meta-analyses of randomized trials for low carb diets, and as we'll hear, there hadn't been much interest in doing these kinds of trials, I think largely because of the drug pharmaceutical mindedness of most doctors, but let's see. Hey everyone, I've got something exciting to share. If you love the content on this channel, our YouTube membership is the perfect way to take your experience to the next level. As a member, you'll get early access to new videos, be the first to see fresh tips and insights. Plus, twice a month, I'll be hosting exclusive live Q&A sessions where you can ask me your keto questions and get personalized advice. You'll also get shout-outs for recommending videos to the community, just our way of saying thanks for helping spread the word. So, if you want early content, direct access to me, and a more personalized experience, hit that join button below and become a member today. Looking forward to seeing you in our live sessions.
Since these participants were highly motivated, considering that they had coronary artery disease, they were on this diet for an average of 3.7 years. And then the researchers measured the plaque in the arteries before and after the diet for some of the participants, as well as tracked if the disease presented itself in all participants, as in, did some experience cardiovascular issues during that time. In fact, the most impressive results are shown here. On the left is the left anterior descending artery, which is the artery of the heart that's often called the widowmaker, because it's so deadly if it's blocked. You can see on the left image, the vessel is much thinner than in the post image on the right side, which shows a thickening of the white space. So that's called the lumen of the artery. That means that the body was able to remove the plaque and reopen the artery, which is an incredible image. I mean, truly.
You know, a clinical series like this one would be like taking a sample out of my clinic, and the limitations of doing that are people who come back are the highly motivated, maybe doing other things to improve their health that we're not measuring. Those are called confounders. The healthy user bias, those who follow the rules tend to be healthy and follow the rules in other ways as well. And the other possibility, though, is that there's cherry picking, meaning the people who don't do well don't come back, and they had bad results even though they were following it, or you're only showing the change that it can happen in one person, and the average, meaning what happened in most people or everybody, isn't shown. And these are legitimate concerns or limitations. And the idea that you're only showing some may be, though, a function of it's not a research study, it's more of a clinical study, so you're not in charge of getting these test results that scan in everyone. In fact, you can't order those scans in everyone, which you would like to see, and that's typically done in a research study, not a clinical evaluation or clinical audit or case series.
This is important because someone could just show images of an outlier, a person who did better than everyone else in this instance, and bamboozle us all. I don't think that actually happened here for reasons that we're about to get into, but it's still a weakness of the study. A second weakness is the fact that this wasn't a controlled study, as in there was no control group. So to see if there were results that might also be experienced in the control group, taking some power away from the idea that this specific diet causes these benefits.
Yeah, not having a control group isn't a huge or a fatal flaw. I'll call there are flaws and then fatal flaws. Randomization is important to reduce the bias if you're comparing groups, or if you want to say that this is the best approach, then yes, you have to have some kind of control group. Although, if you take a consecutive sample of people, so you're not cherry picking, let's see, if you took 100 people at the beginning of the year and followed all 100 at the end of the year, it's including those who aren't following the program or dropped out, that can minimize the bias of, let's just see who made it a year and evaluate them, because now you're getting the people who actually followed the program, and you're going to get, if anything, a bias toward those who did well. On the other hand, if you can show in 100 people that it's totally reversed, the coronary disease, and you're showing it in everyone, you don't need a control group because there's no one else who can do that, right? So you don't need a control group to see if you can climb to the top of Mount Everest, but not everyone can do it. And so this is a kind of vestige of the, it's not a randomized trial, so we can't even consider it as information. No, I disagree. We can learn from non-randomized trials, although ideally, if you want to compare and say that it's better than something else, like usual care, then you do want some sort, or other diets, to say your diet is best, you have to have compared it to other diets or shown that you can do something that the other diets can't do.
As we can see, 105 of 177 individuals experienced improvements in symptoms. 39 experienced actual reversal, and 15 remained stable, leaving 18 individuals as getting worse. Now, at the beginning of this video, we discussed 100% protection from cardiovascular events. So, how could people be getting worse if they were adhering to this diet? Well, I'll let Dr. Esselstyn answer that.
In our 2014 paper, yes, there was one patient who had gone on vacation to China, absolutely began eating off the economy. He had to have hypertension and, of course, all the salt, and he had a small cerebellar stroke. Mm-hmm. He did not follow the program. Right. He is the one patient he was somehow made it into the compliant group. That's not compliance. Mm-hmm. Going off on the economy, and so really, therefore, in that group, nobody had an event for close to 4 years.
Yeah, well, that is the human nature, right? That if you have a program that's very difficult to follow, people are traveling, and although you can do it while you're traveling, it makes it more difficult. And then but the idea that the program is perfect, that's a bit of a stretch. Even in the data there, the symptom reversal was not 100%. And so the idea of a cult of a way of eating and then being banished from it, we got that from Nick a little bit, that if people weren't following the rules, then, well, it's their own fault. Well, we want to come up with a program or a way of eating or a healthy lifestyle for people that they can follow. That even led to the kind of meme out there that the healthiest diet is one that you can follow. I don't agree with that either, because if you have high triglycerides in the blood, for example, and low HDL, that pattern, then you want to cut the carbs down or calories and lose weight, because that element in the blood is particularly improved by lowering the carbs or the calories. And so anyway, the idea of, in fact, I work against this as best I can, that what we do is not a cult. We don't teach and we don't banish people or say you're not part of the tribe and all that. I don't even like that term tribe, but I know it's out there. But if anything, it's the other proponents of ways of eating that make it cultish. We're just trying to follow a scientific approach. And yet people follow an approach and like the idea that they're in a tribe just to help them be strict in a world where there's a lot of temptations, and it makes you feel like you're supported in what you're doing. So, but the idea that it was perfect and 100% reversal, I think it's true. It's being debunked here.
So Dr. Esselstyn's point is that one person was mischaracterized as compliant or adherent, when in reality they were not, which is why they experienced a stroke. I assume that's this one here. And then several more participants had cardiovascular issues due to, according to the researchers, unrelated reasons. For example, undergoing a heart surgery on the advice of their physician. So in the best case scenario, the diet did not result in any cardiovascular events.
So this is part of the criticism of our studies initially, where word got out that I wasn't eating many carbs. And so how could a researcher who doesn't eat carbs do a study on a low-carb diet? Well, I'm a scientist. If I found that a medication was useful for me and it was scientifically proven, I might take the medicine and even do a study of medicine. It doesn't make me particularly biased if I follow the rules of data collection. And here we're seeing perhaps a little manipulation of where the data are sorted or how it's interpreted, which is a reasonable criticism. Have somebody else do the data analysis. Have somebody else come in or replicate what you're trying to do. That would be another approach to just show that it's not just your center that can do it. And I don't see other clinical centers of ultra low fat diets pushing for data collection like this, and yet it still can work. But the flaw or the appropriate criticism about who's in charge of the data really also applies to drug companies. And whoever is funding a study, if a drug company is studying the drug, which is typically what happens, they should have transparency and openness to show the data that they're collecting for outside review. And that should happen even with a study like this, especially where the doctor himself may be super charismatic. And once you get there, the adherence can be better because he or she will help you figure that out. I think I can do better in helping someone adhere to a low-carb keto diet when I meet them and understand it. So he knew that patient had gone to China. This is not hands-off like a research study with equipoise. And on the other hand, I would like to do a study where you have the proponent of the ultra-low-fat Esselstyn kind of approach with a proponent of a low-carb keto approach, and they should be in charge of their groups, and then see how people do over time, because that's the real world, what you can actually have happen with the motivation of charismatic individual.
First, as I alluded, none of these studies are controlled studies, so no randomization, no researcher blinding, no power calculations, no controls, and so on. Second, many of these studies rely on categorical data and don't report much on average data, including standard errors and the like. We have to trust that the researcher's assessment of what is significant and what is not significant, while average data leaves it up to the reader, the analyzer. Third, actually, let me turn to Dr. Carvalho's question in his interview with Dr. Esselstyn. The video to this will also be linked underneath for you too.
So that was one of the questions I had, and I've had people ask me that. Why hasn't there been, after all this time, as you said, Dr. Ornish and your work has been around for 30 plus years, very interesting, encouraging findings. Why hasn't someone taken that and run a randomized trial just with your diet, very low fat, plant exclusive or overwhelmingly plant, and seen if it reverses heart disease? It's surprising to me that hasn't been done.
This is such a good question because it's been something like 30 years of us getting these methodologically weak studies to indicate that this diet works, especially when we have many, many studies that look at other nutrition styles and their cardiovascular effects, including some in plaque reversal. I don't doubt that financial interests are a motivating, or in this case, a demotivating factor. I also don't doubt that a lack of education in the medical field on nutrition is a player. However, that doesn't explain why we have so many trials on so many other diets doing exactly what we're asking of this diet. So scientists and clinicians are uneducated on nutrition when it comes to an oil-free plant-based nutrition, but they suddenly spring into action if it's a DASH diet or the Mediterranean diet and so on. That reasoning doesn't exactly square.
Yeah, so when you look at the funding for the DASH diet and where that came from, it was a diet designed by committee, by NIH researchers, and a diet designed by committee is going to have to, satisfy that researcher, that researcher, and so the DASH diet to me is kind of a diluted down kind of program that means dietary approaches to stop hypertension. Any low calorie or weight loss diet can reverse hypertension, and I don't know any doctor in the trenches, like an obesity medicine doctor, who uses the DASH diet by itself. You're going to be using some other medication and the DASH diet, or calorically restrict the DASH diet to get that weight loss. So again, we're talking different contexts. The DASH diet was studied in relatively healthy people. It's not for, with hypertension, not for diabetes reversal. And so we also got a very laser focused type of diet because it came from NIH scientists in committee, diet by committee. It really, Mediterranean diet, is the darling diet of today, and I even, coach my patients who are having great results to say they're doing a modified Mediterranean diet because it smooths the interaction with other healthcare professionals. But I think the need for diet studies is there's a need. However, people are way ahead of the research. So people meaning now people on their own doing different diets, doctors teaching programs that are way ahead of the research. So if you wait until the research is done before doing something, you're going to be necessarily behind what the clinical doctors and people coming to clinics like mine are actually doing.
So the takeaway here is that there is some extremely impressive but methodologically flawed evidence that indicates a no-oil plant-based diet severely cuts down and possibly eliminates future atherosclerosis-related cardiovascular disease.
Well, so hang on. How can it be impressive yet methodologically flawed? So actually, I like the bullet here, which says it's methodologically flawed, and to me that means you shouldn't trust it. But here he's playing the politics of it's impressive but flawed. So, or it could be that, like climbing Mount Everest, it can happen in some people. Some people can do that, but the average person probably wouldn't be able to make it.
Risk in people with already known cardiovascular disease. Actually, Dr. Esselstyn even argues that olive oil causes heart disease.
Well, I like the video, I like the interview, and I like the critical nature of the interview, and yet allowing for the fact that, yes, this could be true is important as well. And the funding of studies is a strange, sort of complicated thing. In fact, we're going to be talking about studies that have been funded by people themselves coming up. That's the lean health. In fact, we'll be talking about a study that is funded by the people themselves, a crowdsourced funding study. We're going to talk about that one a lot over the next year. And the sources of money, I hope, will change in the future as people are asking for these kinds of things to happen. If you like this video, please like, subscribe, ring the notification bell, and look for new content on Wednesdays and Fridays. If you enjoyed this video, consider joining our YouTube membership for early access and exclusive live Q&As with me. Just click the join button below or support us with a PayPal in the description.